Hi, today is Thursday, August 22nd, 2019, and welcome to my PCD Life. So just a short intro, I'm here at the PCD Foundation conference in Minneapolis. Today was the second day, and we just have a half day tomorrow. But I have a couple of interviews to share, and there were some patient questions people had asked on Facebook, and so one of the doctor that I interviewed today answered some of those. And hopefully I'll have some more interviews tomorrow and maybe a few more answers to some of your questions. So the first interview is with a respiratory therapist. She was one of the speakers yesterday morning talking about different ways of types of airway clearance. And so she talks about that a little bit in our interview. And then the Dr. Rosenfeld is the other interview, and she's the chair of the conference this year. And again, she answers some of your PCD questions. So hopefully you'll find these interesting and informative. So I'm here with Lisa Monchel. She's a respiratory therapist, and we're in Minnesota at the PCD Foundation conference. And Lisa spoke yesterday, gave a session on airway clearance. So Lisa, can you tell us a little bit about airway clearance and the importance for PCD patients?
Sure. Well, all the research that I did to give my talk, the background based on the recommendations from the foundation, which means it was a huge consensus statement, is that airway clearance is the cornerstone of therapy for PCD patients every day. And it should start really early, as soon as the diagnosis is made, or even if, kids are really often sick early on. They're in the nursery, they're on oxygen and on CPAP for a long period of time, and then that can lead you to think that it could be PCD. And one of the other reasons that you want to start airway clearance early is that by 5 years old, 80% of the kiddos have, or by 8 years old, 50% of the kids have bronchiectasis already. So the goal of airway clearance therapy is to prevent more bronchiectasis or prevent it happening at all. And the thing is, there's a lot of different ways to do it. And I feel like everybody should know every way so they can find what works for them. And sometimes it's 2 devices. You can have oscillating PEP, you could have the vest, and chest PT, manual chest PT is still available. But one of the newer things that we talked about is the cough assist and the ability to use that device now that we can add oscillations in for people. And I think it's really a novel, quick way to do airway clearance. I've been very pleased with it, and so have my patients that have used it. And I don't want to forget to reinforce the importance of exercise. And even as little kids, lots of bouncing, lots of running around, playing soccer, riding their bike, racing, being involved in volleyball and baseball. Exercise is crucial, but it can't take the place of airway clearance. It is part of your everyday life as airway clearance. And we know that patients or people with PCD who do airway clearance therapy every day, when it's part of their regimen, they feel better. Their quality of life is better, and more important, their lung function is better. So that's the reason that you're wanting to stay on top of your therapies every day, because you want to keep your lung functions good and improve them if they're down a little bit.
So I'm here with Dr. Margaret Rosenfeld, and she's the chair for the PCD Foundation conference here in Minneapolis. And Dr. Rosenfeld, can you tell us about the research going on in PCD, both past and present?
Absolutely. So there really have been major advances in our understanding of PCD over the past 15 to 20 years due to contributions by investigators here in the United States as well as around the world. And first of all, we've made marked improvements in our understanding of how to diagnose PCD. There are now over 40 genes that we understand are involved in PCD genetics, and that field is still moving forward very rapidly. We also better understand the role of nasal nitric oxide in diagnosing PCD, and better understand how to use electron micrographs not only through ciliary ultrastructure, but also looking at immunofluorescence and other markers to diagnose PCD, particularly in the more difficult cases. We also have a better understanding of the natural history of PCD and how different genotypes relate to the disease progression over time in longitudinal studies. We're also better understanding how PCD compares to other rare chronic obstructive lung diseases like cystic fibrosis or alpha-1 antitrypsin disease, and those studies are ongoing as well. Finally, the first two clinical trials specifically for PCD have both recently been completed, one in Europe studying azithromycin and one in this country studying a special salt channel inhibitor. And those results will be reported soon. Looking towards the future, there's very exciting research going on to better understand the sinus manifestations, to better understand different aspects of ciliary function related to ultrastructural defects, to better understand the relationship of genotype with phenotype, and then also looking at patients who actually end up having primary immunodeficiencies, so problems with their immune systems that can masquerade as PCD. So that's just a little tiny hint of some of the research that is actively funded. Another very exciting thing is better understanding what the potential might be for even potentially curative therapies using gene editing or RNA editing. Those are obviously looking towards the future and in our very early phases, but are quite exciting to think about. And some of those results were presented yesterday.
So on Facebook page, I had opened up to patients and parents questions that they would like to know from experts such as yourself. And one of the questions was, is it important to go to a PCD center? So if you could speak to that either for diagnosis or for regular treatments, that would be great.
Thank you so much for asking that question. So the short answer is yes, I think it's very important to go to a PCD clinical care center. And there are several reasons. In terms of diagnosis, as probably everyone listening to this is aware, diagnosis of PCD is really complex, and you kind of need to triangulate back and forth between nasal nitric oxide, electron microscopy, and genetics. And it's really important to have that be done at a place that really knows how to do this correctly. Then in terms of chronic care, the advantage of having care at a PCD center is that you work with physicians, dietitians, social workers, respiratory therapists who really understand PCD, really understand how to take excellent care of PCD, and really understand cutting edge changes that are happening in clinical care. I am from Washington State, and many of my patients come from very far away, Idaho, Wyoming, far eastern Washington State. And so I know that going to a PCD center is a major difficulty for many patients because of geographical distance. So we can easily work it out that one can be seen in a PCD center of excellence less frequently, but then the physician there can work in close contact with a more local pulmonologist. I hope that in the future there may be telehealth opportunities, but for people who live far away from a PCD center, the PCD center staff can definitely work with a local pulmonologist, and that tends to work out very well.
Thank you very much for watching this episode of My PCD Life, and hopefully I'll have some more interviews to post tomorrow.